Well, here we go. We're starting again. Welcome everyone to the monthly webinar of Physicians for Human Rights. I'm Ziad Mhirsi and I'm a Senior Program Officer at the Forensic Training Institute that's actually hosting this series. I am really happy today to host my colleagues who are going to present PHR's effort around mapping attacks on healthcare facilities and healthcare personnel in Syria. They've been doing this work for years now, and we're really glad to show the results. So without further ado, I have on my right Elise Baker. She's the research coordinator, and Matthew Parsons. She's a program associate. And to you.
Thank you. So as Ziad said, we will be talking about our documentation of attacks on healthcare in Syria using our open source methodology. So I'll give basically a brief overview of how this project started and why Physicians for Human Rights started to do this documentation. Matthew will go into the methodology, and then I will finish with the results and importance of this documentation. So in March of 2011, the revolution in Syria broke out, and basically on day one there were reports of the Syrian government repressing the peaceful protests by shooting at protesters and just inflicting violence on the peaceful protesters. And very early on we started hearing reports as well of not just shooting at protesters, but then shooting at medics who were trying to provide first aid to protesters in the field, security forces also firing on ambulances that were transporting the protesters to hospitals, and then also firing on or going into hospitals and detaining injured protesters who were there, and then also detaining doctors who were providing first aid to the protesters. So we started hearing these reports, and it was clear that this was, happening at a large scale in Syria, but nobody really knew how frequently this was happening or in what areas, or really the scope or the scale of these attacks. And so as the conflict went on, we then started hearing more reports of attacks on hospitals, shelling on hospitals, bombing, more detention and torture of doctors, and targeted killings of doctors. So at Physicians for Human Rights, we decided to do research into this to try to figure out basically how widespread this was happening. And we just started looking into what was available online in terms of open source documentation, and we found really a shocking number of reports of attacks on hospitals and killings of medical personnel. So we decided to create basically an online database that would be accessible to anybody in the public to be able to look into these attacks. We wanted this information to be able to be used by policymakers, by journalists, by partner organizations, really anybody who is involved or interested in the conflict. So we decided to create what turned into an online interactive map, but we also knew that in order for this information to be as useful as possible to especially policymakers, but also journalists and other, anybody else using this documentation, the methodology needed to be very transparent. We needed to be very clear about what we were documenting and how we were documenting it and the sources that we were using. So that was what we were aiming for with our methodology, with which Matthew will now go into.
Okay. So as Elise said, we began hearing about these reports of attacks on medical facilities, and as we began researching them, we kind of did what is to be expected, just some basic desk research through media outlets and social media, and we found a really staggering amount of documentation. It's pretty widely accepted at this point that Syria is one of the most well-documented conflicts, if not the most well-documented conflicts that we've ever seen. And this is largely due to just the proliferation of technology in the country, not just social media, but also just the access that international journalists have being able to wire in and out information. This is a picture, for instance, of the civil defense or the white helmets, and they usually wear these like GoPro cameras or so, and that is just one example of kind of the informal ways that this conflict is being documented. This is just like a basic search of kind of documentation of various attacks. On the left, you have a bunch of videos, and on the right, you have kind of an Aleppo Media Center that is tracking the kind of day-to-day attacks in Aleppo. So you can see that this is just a huge trove of information, and we felt that this could be quite revealing in terms of looking into attacks on medical centers. But of course, open source documentation has its issues. There's a lot of misinformation. There's obviously no unbiased source in Syria or in the world in general. Certainly lots of political motivation. And when you talk about kind of crowdsourced information as well, it turns into this game of telephone where people hear certain things, information gets distorted. So we were trying to figure out how to mitigate these issues and kind of, as a scientific organization, bring a scientific rigor to this research. So we developed a methodology that tried to kind of systematize open source documentation so that we kind of could know what we were looking for, how we were going to look for it, and how we were going to make our determinations. So the first of three parts of our methodology is we defined what an attack on a medical facility is, just so that we could always have something to return back to when we were kind of making our determinations. So our definition is an attack is defined as a violent assault upon a facility resulting in any destruction, damage, or loss of the facility's function, equipment, or medical supplies. So this is really important just because it highlights the aspect of the interruption of provision of healthcare in some way. So that is something that we always look for when we're looking into these attacks. The second part is our investigation method. So this is really telling us how we go about looking for the documentation that we find through open source methods. And then the third part is our analysis and review stage. So how we make our determinations, how we decide if we're going to document an attack or not. So this is a little infographic about how we actually go through this process. So I'm just going to briefly walk you through the process and our decision-making techniques, and then kind of go into a more granular look into our investigation process and review process in particular.
Matthew, sorry, can I interrupt you? Your definition didn't include intentionality.
Mm-hmm.
So at what point is an attack must it be intentional in order to be an attack, or can it be an accidental bombing? And then at what stage in your investigation is it necessary for you to ascertain that it was intentional? And is that part of what you're about to tell us?
Yeah, so I'll get to the second part. Yeah.
Let's first repeat the question because the mic is a bit far.
Sure.
Maybe some of our participants didn't hear that.
Yeah.
And I would basically maybe invite everyone to ask questions after the presentation.
Okay, sorry.
So we'll finish this presentation within like 15 to 20 minutes, and then we'll open the floor for questions.
So the question that my colleague asked was essentially about the aspect of intentionality and whether we determine, in our definition, she noticed that the intent aspect is missing. And so when do we make that determination? Are we looking for intent? And then I guess the second part was about when that plays into our actual investigation process.
And how
we determine that, right.
Yeah.
So I'll get to the second part of that question, and then Elise is going to get to the first part of the question later. But briefly, essentially, the answer to the first part is that we map both attacks that are intentional and seem to be targeted and indiscriminate attacks. Both are violations of international humanitarian law. It's just two different analyses, which Elise will get into more. So just to kind of walk through the process from a basic standpoint. So we begin the process with what we call a news sweep. So every day when we come into the office, the Arabic speakers who work on the project do a very basic search through Google just to see what new attacks have happened since the last time we have done one of these. Then we log all of these mentions of attacks into a database, and we wait at least a week until we return back to those incidents. We wait a week essentially because at that point, everything that will be written about the attack will have been written after a week usually. So once that time period has passed, then we return to each incident in particular and do a kind of more targeted investigation. And again, I'll get into kind of the granular aspects of our investigation in a moment. After we do our investigation, we organize all the sources we find, we translate everything, we do some basic analysis, and then we review every single incident and every single source for each incident. At that point, we're able to determine the quote-unquote mappability of these attacks. So obviously that's not a real word, but we've made it into one. And so the three categories that we can kind of sift these incidents into are what we call mappable incidents. So these fit our definition of an attack. Uncorroborated incidents where we just don't have enough information to really make that determination. And then unmappable incidents. So these incidents maybe don't fit our definition of an attack for one reason or another. All right. So when we do our investigation, and this is kind of what I'm going to focus on for the vast majority of this presentation, this is kind of the most time-intensive process. We spend probably between 2 to 5 hours investigating each incident. And what we're doing is we're looking for every single mention of an attack that is publicly accessible. So the reason why we look for every mention of an attack is because there is a tendency, I think, when we're approaching open source documentation to kind of look around, you find a couple good sources, and you call it a day. But we've found that the more sources you develop, obviously the more data you have and the more informed your determination will be at the end. But also there have been quite a few times where you find this kind of game-changing sources. A source that maybe mentions that the hospital is still in service or the medical facility is still in service, and that obviously changes your analysis. Or maybe an article that mentions there is a military facility nearby and there were military activities that day. And that obviously also changes your analysis. So we're looking for every single source online. So we go through Google, Facebook, Twitter, and Google Video to find our sources. This is an example of just kind of one of the types of sources we find. It's an article, kind of more long form. It's specifically about the attack on the hospital itself. A little pro-opposition leaning, and it provides some good detail. Obviously, it's in Arabic, but we will look at the translation later. This is an example of a Facebook post we might find. Oftentimes, they're a little bit less detailed, but what's great about these is they're posted in close to real time, and they're sometimes posted from very relevant social media accounts. So this one being from a medical facility itself. They also oftentimes include pictures of damage and medical supplies. Here's an example of a tweet. Obviously, you don't have much room to kind of convey details in a tweet, so they tend to be a little bit less detailed, but they can link to other sources that you might not have found through Google. And then this is obviously a screenshot, not a full example of a video, but the videos are obviously really great tools just because they can include walkthroughs. They're very rich texts. They can provide kind of voiceovers with details about the attack, and then you can obviously analyze damage, the extent of destruction, and whether the facility was in service or not, looking for medical supplies and such. So moving on, we do our whole investigation, and as we're looking for every source that we can possibly find, we can sometimes end up with hundreds of sources, and that's not really an exaggeration. Especially as we move throughout the conflict, and especially as there's been more media attention paid to these attacks, there have been a lot more people talking about them, and they can really, the sources that we find can really number in the hundreds. So we have to go through and organize all these sources into a more kind of digestible narrative that we can then analyze. So the way we organize these sources is we're essentially analyzing each source for data content. So we're not looking so much for the language about whether two sources are saying the exact same thing, but really we're looking for whether the data conveyed is the same. So this is an example of two tweets. So the tweet on the top by Christian Turner says Russians make several airstrikes on the field hospital in Garbia, which completely destroyed the medical facility. And then we have this other tweet from the local coordinating committees, and it says Russian warplanes target the field hospital in the town of Garbia with several airstrikes, which completely destroyed the hospital. So obviously there's slight difference in the language, but they're conveying the same basic points, like that it was Russia, that there were several airstrikes, and that the medical facility was destroyed. So we would consider this to be the same source. So that's really important when we're thinking through like what is an independent source. And so we're basically looking to get to pare down the hundreds of sources that we have into maybe 15 to 20 sources or so. So then once we organize everything, we translate all of the sources from Arabic into English. And we also, if we have any videos, we go through a fairly rigorous video coding process where we translate what is spoken from Arabic to English, translate anything that's written in the video from Arabic to English, and do some brief analysis about what you see in terms of destruction, in terms of medical supplies, etc. And so that is pretty much the investigation and organization aspects. They, again, are kind of the most time-intensive, but they lay the foundation for being able to make a very well-informed determination. So the next aspect is kind of the analysis review stage. So what we look for when we're analyzing sources, we employ what we call a two-tier analysis. So the first tier would be the source itself. So not only the source that is posting the information, but also the data that's provided, or the data content in the source. So when we're looking at the source, if we look at this tweet again, it's posted by this Twitter account named Now Damascus, which is a kind of pro-government leaning media source. And then if you look at the translation, there is some language that could suggest the same kind of bias. So specifically, missiles destroy a field hospital for armed groups in Garbia in eastern Daraa countryside. So we look first at kind of the source. We look at whether it's a real person. Obviously on Twitter there can be fake accounts, there can be news aggregators, and we try to evaluate the geographic proximity of the source to the actual attack. So for instance, if you have an attack in Daraa, like this attack that we've been looking at, and somebody from France or something is posting in Arabic about that attack, there are questions about that, about the access to information on the part of that source. This next source that we saw earlier is posted by the actual facility that was allegedly targeted on this day. And so this is an example of a source that is in close proximity to the facility. It is actually the social media account for the facility itself. And this is really kind of the best source that we see. The next best would probably be like a local medical organization, so maybe like a medical coordinating committee for Daraa in this case. And then it kind of ranges out from there. So then you go into kind of local activists, and then Syrian media, and then international media. So once we've analyzed the source and kind of ascertained kind of how we feel about the source and its credibility, we look at the source's content. And so we really first look for whether the information provided in the source is internally consistent. So what that means is if the narrative that is being provided through the source's content makes sense. So this source reads, this morning Russian aviation targeted the hospital for the second time, causing extensive damage to the facility. And then below it says, we will continue working as, or we hope to continue working as a mobile medical point until we find an alternative location. So this is a clear narrative that the facility itself was attacked, it was damaged, and now they're trying to kind of figure out what to do next. An example of maybe an inconsistent narrative is we've seen multiple sources that say a fighter jet dropped a barrel bomb on a particular town or facility. That's just logistically impossible. So that would be something where we would kind of raise our eyebrows about and look, maybe return to the source and see who this person is. So after we've looked at the source in isolation and analyzed the source's credibility and the data content, we compare all of the sources for every incident and see if there's consistency across sources. So I've bolded in this translation a few data points that we are particularly interested in. So we have a perpetrator, which is Russia. We have the fact that this is the second time that this facility might have been targeted. There's extensive damage, and they're hoping to find an alternative location. This next article, which we saw earlier, it provides a few more details, but again, we have kind of the same data points. So we have Russian warplanes caused massive damage. They're hoping to find an alternative location, and this is the second time this hospital has been targeted this month. So that is an example of two independent sources that are still consistent. And so here in red, I've highlighted the additional information. So again, this is why we consider these two sources independent from one another, because this article provides data points that are slightly different from the other Facebook post. So after we've kind of done that analysis and had that discussion about every single source for the incident, it's time to make our determination about whether we're gonna put this incident on the map. So for this, we always return back to our methodology and return back to our definition. So when we're making this determination, we use a reasonable belief as our standard of proof. So would a reasonable person, first of all, believe that this incident happened after looking at all of the documentation that we've compiled? And second of all, would that reasonable person believe that this was a violent assault that resulted in damage, destruction, or the loss of the facility's function, equipment, or medical supplies? So for this particular incident that we've been looking at, we've seen 3 independent sources, obviously of varying degrees of detail. There are quite a few more sources that I'm not showing you just because of time, but we have some clear documentation. We have photos, we have videos, and it seems clear that the attack happened and that it resulted in pretty significant damage. So we did end up mapping this attack. There is one thing that I should mention is that we always try to look for 3 independent sources at least. So although we might have more, if we have less, it really would take a lot for us to map something on less than 3 independent sources. So we've looked at kind of the process in a granular level. But I do want to stress that our methodology requires so much that we obviously do not end up mapping everything. In fact, we receive probably, or we end up corroborating probably around half of the reports that we receive. So if we return back to this source, in the bottom paragraph, this source is saying this is the second time that this hospital has been targeted this month. So we returned to the facility's Facebook page and tried to kind of poke around to see if there was a mention of another attack that happened earlier. And there was, in fact, another mention, and this is one of the pictures that they posted. And so we did the same kind of process. We investigated the attack. We went through Google, Facebook, Twitter, and YouTube. And what we found were a lot fewer sources. I would say probably 10% of the sources that we found for the other attack. The sources were very inconsistent, reporting completely different perpetrators, completely different weapons. And then the photos that we had actually showed fairly insignificant damage. So this is a picture of a vehicle. It appears that there is, like the back window is shattered, but it really doesn't look like there's much damage. So we were not able to corroborate this attack. So this one kind of fit into our large category of uncorroborated incidents. So that is pretty much the process. And I know that we kind of, because of time, I've kind of like rushed through this a little bit. Our findings and our methodology are available in PDF form under our handout. So if any of you want to review this in a little bit more detail, you are more than welcome to. And of course, I'm happy to answer any questions that you might have. So I'm going to turn it over to Elise to talk about the impact of our work and open source documentation in general.
This is the online map that we created based on this methodology that Matthew just walked through, and we released the map in May of 2014. So actually, we are like right now in the 2-year anniversary of the map. And we update the map each month with the most recent documentation. So we have continued to do these monthly updates for the past 2 years and have documentation from dating back to the start of the conflict. So in total, we have been able to document and corroborate 365 attacks on 259 separate medical facilities and the deaths of 739 medical personnel. So the numbers that are on the map right now are slightly outdated. We'll be updating the map later this week with the most recent data, which goes through the end of April. And as you can see from the map, so the different points on the map represent the different attacks on medical facilities, and they are color-coded by perpetrator. So blue represents Syrian government forces, white are Russian, blue and white are either Syrian or Russian. We couldn't determine for those cases which one exactly it was. And then the sort of yellowy orange is non-state armed groups. We've documented one attack by coalition forces, which is purple, and then the green are the unknown attacks. So as you can see from the map, obviously the vast majority of the attacks we've documented are by Syrian government forces. So over 90% of attacks on medical facilities and over 95% of deaths of medical personnel are by Syrian government and allied forces, meaning Russian forces, basically, in areas that are controlled by either the opposition or ISIS. And as Matthew said, because our methodology is very rigorous and we require, at least 3 independent sources to document an attack, and we have, hundreds of attacks that we have not been able to corroborate, but that were reported. We know that these numbers are very conservative. They are basically the very conservative estimates, and we know that they do not represent everything that has happened in Syria, but they provide a very strong baseline for arguing that, these attacks on healthcare in the Syrian conflict are incredibly widespread and systematic. So each attack the types of attacks we're documenting are either targeted attacks on medical facilities or medical personnel, or indiscriminate attacks on civilian areas that are resulting in damage or destruction to medical facilities. The reason we chose these 2 different groups of attacks is that these are both obviously violations of international humanitarian law, and they are also war crimes. And given the number of attacks we have seen by Syrian government forces, the widespread and systematic nature, we are able to say that their assault on healthcare amounts to crimes against humanity. So I'll go into now what we look for to determine whether an attack is either indiscriminate or targeted. So indiscriminate attacks are attacks that are using weapons that cannot be targeted. So this would include barrel bombs, cluster munitions, other weaponry that cannot be precise in targeting a specific location. So the photo that's on the screen right now is a picture of a doctor standing in front of his hospital, which was barrel bombed. So barrel bombs are indiscriminate by nature. They're dropped from helicopters. They cannot be guided where they are going to hit, and then when they do hit, they basically shatter into thousands of pieces, and the very large ones can decimate an entire city block. So they have no way of targeting a specific location. They can only be aimed at, a general neighborhood or even a general town. So the Syrian government does not use them anywhere near front lines because they could potentially hit their own fighters. And then the other types of indiscriminate attacks are when there are basically widespread assaults on an entire geographic location. So basically carpet bombing of an area that is not targeting any specific, military facility or, any military target in particular, but is just bombing an entire location. So as an example, this past December, or one of the places we see a lot of these attacks is in Douma, which is a suburb of Damascus. So this past December, on December 13th, we received reports of 3 different attacks on medical facilities there. And as we were researching these attacks, we were finding dozens of other reports of bombings on the town that day. And it just became very clear that this, basically everywhere in the town was bombed that day. Hospitals, schools, markets, mosques, and none of these appeared to be targeted besides just targeting the entire town. For targeted facility attacks, the data points that we're looking at are where the hospital is. So we have a number of locations where the hospital is located in an isolated area. There's no other building near it. So it's pretty clear that that was the facility that was targeted itself. So this is a picture of a hospital that was bombed by Russian forces in November. There is no other building around it, and it was a direct hit to the facility. We also look at, we've seen multiple attacks on the same hospital in a short period of time. So there's one case where we documented 4 attacks in about a 2-week period on the same hospital. That tends to suggest that the hospital was being targeted. We would also look at attacks in the same geographic area. So looking at like multiple attacks in a small area over a short period of time. So there is last August, there was one day where 5 different hospitals were bombed within 2 hours of each other in about like a 30-mile radius. That would tend to suggest that those were all targeted assaults. And then we also have cases where, or the Syrian government and Russian forces also are using this tactic of double tap strikes, which basically means they launch an attack, normally bombing, wait about 10 to like 40 minutes for first aid responders to arrive, where medics will be providing aid, civil defense workers will be pulling people from the rubble, and then they launch another attack on that same area targeting those rescue workers. And then for medical personnel, we have also documented over 150 cases of torture and execution by Syrian government forces of medical personnel. So those are obviously targeted. So this, I'll walk through just a brief example of a series of attacks that appeared to be targeted. So this was earlier this year on February 15th. At 9:30 in the morning, there was an MSF-supported hospital in Hamadia, which is at the southern end of the map, that was bombed at about 9:30. 45 minutes later, after rescue workers were there, providing first aid, pulling people from the rubble, the hospital was bombed again. So this second attack ended up killing about 25 people in that attack. The injured from that attack were then brought north to a hospital on the northern end of Marat and Amman, which is, it's about 3 miles away. And half an hour after that double tap strike, the hospital where the injured were brought was bombed. And that was a SAM-supported hospital, and I think at least 3 people were killed in that attack. And so this is a series of, numerous attacks on multiple facilities in a short period of time, double tap strikes. And then we also, for the Marat and Amman facility, the red box is outlining the hospital. So this is a hospital in a very large compound on the outskirts of the city. There's not a lot else around it, and this is also a hospital that was established by the Syrian government's Ministry of Health. So it was previously run by the Syrian government. They absolutely knew where it was. It's located on maps. They used to run the hospital, and they have also bombed it twice before. So this series of attacks really just points to the type, or the different types of targeted attacks that we see. So with the documentation in the map, we had both short-term and long-term goals. The short-term goals were basically to inform people, the public, media, policymakers, and partner organizations, and just the general public of attacks on healthcare that were happening in Syria. So we have been very successful in that in terms of, I mean, especially with the media coverage we've seen over the past 6 months or so, and even just the past couple of months, attacks on healthcare in Syria are very widely recognized as a specific aspect or type of institution that is being targeted in this conflict. We also have been very successful in informing policymakers of our documentation. Our monthly data are included in each, or the monthly report from the Secretary General to the Security Council each month. We have also been able to use our data to negotiate or help pressure different missions to the UN to support passage of different Security Council resolutions. So when we launched the map in May of 2014, the Security Council was negotiating what became Resolution 2165, which allowed cross-border aid to be sent directly from Turkey and Jordan into Syria, directly into opposition-controlled areas, rather than being funneled through Damascus, where the Syrian government then wouldn't allow the UN to deliver aid to opposition-controlled areas. So we launched the map and were able to show the hundreds of attacks that had occurred in areas outside the Syrian government's control, really pointing to the need for humanitarian aid to be delivered directly there. And then our partner organizations also explain that this data is really important for them in advocating about specific attacks on their facilities. So when the most recent attacks in Aleppo happened, our data was able to provide context to these attacks, saying, this is not just one attack on a hospital, this is the 360th attack in the past 5 years on a hospital in Syria. And then the long-term goal of our documentation is to create basically a database that can be handed over to a future judicial mechanism to be able to investigate and prosecute these attacks as war crimes. And the reason we are able to, the reason our documentation would be able to be used in the future is because we have taken such a rigorous and scientific approach to using open source documentation. So, I mean, as Matthew was saying, this conflict is one of the most prevalent conflicts on social media. There's an incredible amount of information that's available online, and that means that you have access to a huge amount of information. There's no organization that can cover the entire country of Syria with field sources because that would be incredibly resource intensive, and there's also no organization that would be trusted by the Syrian government, opposition groups, and ISIS. So what open source documentation allows you to do is get access from, or get information from areas that you do not have access to or that your sources don't have access to. But obviously, because open source documentation can, have biases and needs to be verified, you have to go through a rigorous process of corroborating this information. You cannot just take it at face value. You can't just create an open source map that you expect to hand over to, the ICC in the future, because there would be a lot more information there that would probably be wrong. So what we are able to do is gather a huge amount of information and then put it through a rigorous methodology that allows us to corroborate it and turn it into, information that makes sense. The other value of using open source information is that you're able to go through this information in close to real time. So often attacks are reported online minutes after they happen, and we are able to, do this documentation on a monthly basis and produce analysis on a monthly basis that is basically giving you information about the conflict in very close to real time that we can then give to policymakers or to journalists or whoever else wants this information so that they can, keep up to date and they're not using this very old information. And when you're also using open source documentation, there's so much out there that you can't retroactively go back through it. So if we were trying to do this type of documentation 10 years from now, there would be so much information that we would be trying to wade through that it would be basically impossible. So we have nearly 10,000 documents that are supporting the documentation we've done on our map, and just trying to go through that later on would be incredibly difficult. And a lot of that information would also be deleted. So we find that Facebook posts, YouTube videos, Twitter accounts, a lot of these end up being deleted later on. And so what we're doing as we're collecting this documentation is archiving a copy of every single source we are reviewing so that it can be part of the database that we hand over in the future. So the specific value of our documentation in Syria, which is obviously a conflict where a lot of different groups are documenting, is that we are able to use open source documentation in a very credible way and also do it in real time to produce a comprehensive picture of the country. And being able to cover the entire country and produce reliable data means that that is what allows us to say that we are seeing widespread and systematic assaults on healthcare that rises to crimes against humanity in Syria. If you don't have a full picture of the conflict, if you're focusing on one area or one time period, you might not be able to say that. But because we are using open source documentation, we are able to get that full picture and produce that sort of analysis and do advocacy around it. But the documentation we're doing on Syria is not, inherently specific to Syria. So you could take the type of documentation on attacks on healthcare that we're doing and apply it to other countries that are facing attacks on healthcare, say Yemen or Ukraine or a number of dozens of other countries. And you could also take the methodology and use it to document different types of attacks. So attacks on schools, markets, mosques, really any different type of attack that you want to be looking at. All you need is access to open source information and ideally field sources to be able to back that up. And you could be doing this type of analysis in other contexts. So part of what we're also doing at Physicians for Human Rights is standardizing and documenting our methodology process so that it can hopefully be used in the future for other contexts and other conflicts. So now we will open it up for questions.
Yeah. Well, thank you so much for this presentation, and I cannot say enough about the team that has been working on the map for many months, going through all the documentation that is out there and summarizing it in these monthly findings, and yeah, it's an incredible amount of commitment and time and motivation to move this project forward. So let's open the floor to questions. So basically, we're going to be asking questions. There is a window on your screen where basically you can ask questions. Meanwhile, while you type your questions, I'm going to open the floor to our room in New York.
So I have two questions about methodology. One of them is, do you ever chase down, you mentioned that there are some incidents that are not mappable or that for some reason don't rise to your standards in terms of being able to be mapped. Do you ever use previously reliable field sources to chase down something that you have a suspicion about?
Yeah, so that's a really good point that
So just to repeat the question, so our colleague was asking whether if we have not been able to corroborate an attack, whether we might go and speak to field sources who have been credible and been able to give us information in the past to try to corroborate that attack.
Yeah. So that is a step that I overlooked when I was walking through the process. So definitely because there are these kind of countless attacks that or reports that we receive and we are unable to corroborate. We will follow up with field sources when we have access. So we are obviously constrained geographically. Oftentimes we have field sources located more often in opposition-controlled territories, just because there's kind of an easier trust there. And so we are able to, when there's an attack that may be close to being documented or close to being corroborated, maybe we have 2 independent sources, or we have 3 or 4 independent sources, but the information is a little bit vague or so, and we want a little bit more detail, or we have detail but we don't have documentation, for instance. We're able to reach out to field sources and see if they have more detail, if they have photos, if they have videos, etc.
And how do you develop, I'm not saying specifically who are they, but how do you establish that person or group is reliable? Where do they come from?
Yeah.
Yeah, so the question was how do we develop field sources who we know can be trusted? So it has happened, I would say, relatively naturally in reaching out to medical organizations who are working in Syria, being put in touch with doctors who are working on the ground, and other groups that are doing documentation in Syria. So I mean, there's definitely an issue of, you need to know that the source you're talking to, especially with field sources, is credible. And so most of our field sources are medical professionals who are working in Syria, who we have met, who we understand where they would be getting their information from.
Well, let's move to the questions that I asked online. I hope you all figured out how to ask the questions. It can be tricky if you're using the software for the first time. So I'll start with Magali Set. Magali asked, how many people are working on this database specifically, and how long does it take to document one attack?
So you are looking at the team mostly. It's Elise and myself, and then we have a lovely dedicated group of interns who are sitting right to my right, actually. And so right now we have about a team of 2, 3, 5 people, I believe.
2 full-time and 3 part-time.
Yes. So it's, to be honest, quite a commitment. There's a lot of documentation that 5 people have to go through. And to answer your question about how long does it take to document one attack, it does depend on the attack. So for instance, the recent attack on a Quds hospital in Aleppo, that is an extremely well-documented attack. It took many, many hours to gather all the sources. From start to finish, it can probably, I would say the average is, so we have, I guess, between 2 and 5 hours to investigate the incident itself, and then about an hour to review the incident. Obviously, it can be more or less. So it would range from 3 to 7 or 8 hours. And so if you have upwards of 30 attacks in a month, it can be quite a time commitment.
Excellent. We'll move to Neilu Golchanara. The question is, how recent are this data?
Yeah, so the data that I presented for 365 attacks on medical facilities and 739 deaths of medical personnel, that data goes through the end of April. So we don't have data from the past 16 days, but data from before then.
But usually the reporting cycle, if you can explain it.
Yeah, so we, as I said, we go through, or we update the map each month with the most recent data, and we're normally updating the map about, around mid-month of the following month. So we will be updating the map probably later today or tomorrow with data from April. So by, by about the 20th of the following month, you can expect that the past month we'll have data updated then.
And I hope everyone has access to the URL where the map exists, so you can go there and there is a link on findings that you can find the most recent report. I'll move to a question from Derek Congram. He's saying, it seems your assessment about directed, indiscriminate attacks are based on best judgment. Are you doing any spatial analysis using geographic software, GIS, to validate or refute any of your assessments?
Yeah, so that's a really good question. First of all, on the first point, that's a very astute evaluation of this project. So in our methodology, as I mentioned, we are using the reasonable belief as our standard of proof. And so this is so that we are able to make this methodology replicable. And so that's a good evaluation. To the question of are we doing any spatial analysis, we do not ourselves do any in-depth spatial analysis using any specialized geographic software. There are times when we find it useful to geolocate the facility itself and analyze the satellite imagery that we can find on Google Earth, just to kind of ascertain the surroundings of the facility. We've had a partnership with AAAS, which is the American Advanced
Association for the Advancement of
There we
Science.
go. I'm really bad with acronyms. Who have been very kind to do some analysis of satellite imagery for us on particular facility attacks. But oftentimes, the open source documentation that you can find is so rich that with as we've set our standard of proof to be like the reasonable belief or the reasonable person, it really provides a lot of rich analysis that we can do.
I mean, I would just say that we do always try to locate a facility on the map. So, I mean, just as example of the attacks in Mara and Andaman that was showing earlier, like those are two facilities where we know where they're located and we're able to look and say, there's not a lot around here. This is a large compound, this is a very large hospital, and that adds to our analysis. Or, we'll have cases where we know that this is a small hospital located in a very densely populated area. And that just having that information, adds to the type of analysis that we're doing. But there are also a number of cases where we don't know exactly where the hospital is. We don't know the exact building on the map because so many of these facilities are now, field hospitals or medical points or clinics that have been moved around and are in secret locations because they are being targeted. So we do that as much as we can. But, I mean, as Matthew already said, we're not using anything like GIS, just looking at like Google Earth to be able to find these facilities.
If you want to ask questions in French or in other languages, we have, I think, the capability to translate them, so please feel free. I know that 177 people registered for this webinar, and many people are coming from different countries, so please feel free to ask questions in the language of your choice. So I move to Abiodun Babayeju. He's saying good presentation, guys. My question is that it seems most of the data tend to focus on the Syrian government and the abuses. How do you relate this abuses? How to relate to the abuses caused by the opposition and other rebel groups? And again, how do you sieve the information to remove biases emanating from your sources of information? So it's a question about Syrian government abuses versus opposition and other factions, and also like the bias coming from the sources.
Yeah. I can do the first one. Do you want to do the second? Sure. So just in terms of, documenting attacks by opposition groups, so we are always looking at every single attack that is reported. So if we have a report of an attack on a hospital in a Syrian government-controlled area by ISIS or by opposition groups, we will absolutely investigate that and try to find every single source that is out there. So we definitely have an issue in finding sources talking about those attacks because there is just so much more control by Syrian state media that when an attack is reported, we often just find the same language repeated over and over again. Basically, like Sana, the Syrian Arab news agency, will use one sentence, and then all of these other pro-government outlets will just copy the same sentence. So when you're looking at our methodology, where we require 3 independent sources, that does not rise to the level of documentation that we need. So we are looking at all of them, but again, we have only corroborated, I think it's now 25 attacks by non-state armed groups, with 12 of them by opposition groups and 13 by ISIS. We do everything in our possible, or everything that we can to corroborate these attacks, but there is obviously a source limitation as well, because we have tried to reach out to sources in government-controlled areas, but they're obviously not very comfortable talking to a human rights organization. But I would say, based on the documentation that we have seen, we are very comfortable in saying that the vast majority of these attacks are perpetrated by Syrian government forces, and this largely has to do with the fact that the Syrian government has access to an air force and the opposition does not. So that means that the opposition can shell hospitals, and we have documented attacks like that, but the Syrian government can fly warplanes or helicopters and bomb hospitals that are very far behind front lines. And so there is just a very significant resource difference between the two forces, and that is contributing in a very large part to the types of attacks that we are seeing.
And then to answer the second part of the question, so how do we sieve information to remove biases emanating from the sources of information? That really, the way we try to mitigate that, or to strip out biases as much as possible, is to look for every single source possible. So if there's an attack that happened in an opposition area, you not only look at obviously opposition sources with kind of pro-opposition biases, but you also look at what pro-government sources are saying and what international sources are saying. There have been many times. There's one incident that I'm thinking in particular where everything seemed very straightforward. There was a lot of pro-opposition media covering this one attack on a facility, saying that this happened, that it was in service, etc. And then there was a video showing that it was being used, or it was located in a compound used as an organizing point for like an armed group, and they verbally say that they evacuated the facility during that entire week that it was hit. So in that sense, the kind of methodology that requires us to find every single source possible and every mention of the attack allows us to kind of weed out what is actually happening here. And then we also just analyze the language too. I mean, if somebody is if there's a source that's saying this is an ISIS hospital or this is a Jabhat al-Nusra hospital, we usually kind of just we don't pay much attention to what affiliation it's saying. We're more looking for whether the hospital was in use as a medical facility at the time. So we try to weed out the kind of linguistic biases as much as possible. And then the other data points that range or are oftentimes inconsistent due to biases are, I mean, there's a lot of exaggeration about casualty counts, or there's a lot of misinformation about casualty counts. There's obviously the subjective evaluation of extent of damage and destruction. So when we see one tweet that says the facility was completely demolished, that's not enough for us to be like, okay, yes, the facility was probably demolished. So it's really getting at that idea that you're looking for every source, and so you have as much data as possible to kind of be able to figure out what's happening. Not to say it's 100% perfect or 100% accurate, but it does definitely substantially reduce the impact of biases on our analysis.
Okay, so one last question again from Magali. She's actually asking about the management of the archiving of the information. How do you archive the information? Are you downloading every video from YouTube? Or are you using a specific database? If you tell us a little bit about the backend.
Yeah, so it is actually possible to download videos on YouTube. There are various websites that allow you to preserve videos for free. So we use a particular service that allows us to download these videos. It encrypts them, and then we preserve them on our kind of PHR backup storage. And we preserve obviously all of our sources in PDF form. And then we also have written translations that are preserved alongside. The specific database that allows us to archive everything, we have historically been using the Palantir database that has allowed us to do quite a substantial amount of archiving and organization. But we're kind of moving into a new phase of our documentation, trying to kind of build out a more narrative form of the database. So we're looking actually right now how best to kind of do qualitative analysis through other databases and how to best represent our data in a qualitative way.
Well, thank you. This brings me to the last comment we received from Keith, who said basically that he will use this approach for his Zimbabwe project. But I will invite everyone to write to us and share with us their plans. I want to thank everyone for attending. Some of you are media representatives who have been citing the map. Some others who are maybe some of our funders or future funders who are interested to give more resources to this team to do this job in Syria, but also in other countries where conflicts are taking place and attacks on healthcare facilities. So this video and this presentation is going to be available on YouTube. So you will receive an email from us, so you can, if you weren't able to attend this live, or if you want to share this with other colleagues, you will be able to do so. Well, thank you again for attending, and we'll see you next month. You stop the broadcasting. Just don't end it. And if you want to write something.